Sacral plexus. The sacral plexus is formed by mainly anterior primary rami of S1, 2, and 3, which emerge from the anterior sacral foramina. This is the main part, S1, 2, and 3. In addition to nerve from above and the nerve from below. What is the nerve from above? This nerve, which is called lumbosacral trunk, which is formed by the lower part of the anterior ramus of L4 and the anterior ramus of L5. The lower part of the anterior ramus of L4 unite with the anterior ramus of L5 to form lumbosacral trunk, which descend on the ala of the sacrum. This bone is called the sacrum, and this part of sacrum is called the ala of the sacrum. Ala means wing. Therefore, the lumbosacral trunk descend on the ala of sacrum to join S1, 2, and 3. In addition to S4, S4 like L4. S4 divide into upper part join the sacral plexus, while its lower part join the coccygeal plexus. Therefore, because lower part of L4 share in the formation of sacral plexus, while its upper part share in the formation of the lumbar plexus, and the same S4, its upper part share in sacral plexus, and its lower part share in coccygeal plexus. Therefore, S4 and L4 are called nervus furcalis. Nervus furcalis, which is a link between two plexuses. Where is the sacral plexus is formed? Sacral plexus is formed in the lesser pelvis. Where is the arrow? This is the lesser pelvis. In the lesser pelvis? In the posterolateral part of the lesser pelvis, in front of this bone and this muscle. This bone sacrum and this muscle is the piriformis. Therefore, sacral plexus is formed in the posterolateral part of the lesser pelvis in front of sacrum and the piriformis muscle. And all these structures, sacrum, piriformis, and sacral plexus, lies behind two parts of the GIT, lower part of sigmoid colon and rectum, and close related to branches of internal iliac vessels, and passing here the ureter. Therefore, sacral plexus. Behind sacral plexus there is sacrum and piriformis. In front of sacral plexus there is rectum, lower part of sigmoid colon, ureter, and branches of internal iliac vessels. What are the branches of the sacral plexus? Branches of sacral plexus can be remembered by the following. First of all, two nerves arises from the roots of the plexus. two nerves arises from the roots of the plexus. What are the nerves arises from the roots of the plexus? Nerve to piriformis and pelvic splanchnic nerves. Pelvic splanchnic nerve. This pelvic splanchnic nerve is autonomic nerve. Therefore, from S2, 3, and S4, this nerve arises as splanchnic nerve. Therefore, autonomic nerves arise from S2, 3, and 4 is splanchnic nerve. This is autonomic parasympathetic nerve. In addition to nerve to piriformis, which is this muscle. And there are two gluteal nerves arise from the posterior aspect. Two nerves arise from the posterior aspect of the plexus, which are nerve supply of gluteal muscles. From posterior aspect of the sacral plexus arises branches passes in the greater sciatic foramen, which are superior and inferior gluteal nerves. This is the superior gluteal nerve. Superior gluteal. Okay. In addition to inferior gluteal nerve, which is passing here in the greater sciatic foramen. Two muscular branches arise from the anterior aspect. Two muscular branches arise from the anterior aspect, which are nerve to obturator internus. Nerve to obturator internus. And nerve to quadratus femoris. Nerve to quadratus femoris and nerve to obturator internus. And two cutaneous nerves. Perforating cutaneous nerves and posterior cutaneous nerve of the thigh. Posterior cutaneous nerve of the thigh. Finally, the most important are terminal branches. The sixth nerve in the body, which is sciatic nerve. And the nerve root is important in sciatic nerve. Other nerve roots in other nerves is not so important, but the most important is nerve roots of sciatic nerve, which arise from lumbosacral trunk, L4 and L5. In addition to the main nerve roots, S1, 2, and 3. In addition to this nerve, what is this nerve? This nerve is pudendal nerve. Therefore, the two terminal branches of sacral plexus are sciatic nerve and pudendal nerve. Therefore, terminal branches, pudendal and sciatic. Other branches from sacral plexus as cutaneous, perforating cutaneous nerve, and posterior cutaneous nerve of the thigh. From the anterior aspect, nerve to muscles, obturator internus and quadratus. From the posterior surface, gluteal nerves to the gluteal region, superior gluteal and inferior gluteal. And two nerves in the pelvis, nerve to piriformis and parasympathetic nerve called pelvic splanchnic nerve. These are the branches of the brachial plexus. Thank you for good listening and good luck.